According to a source familiar with the president's health, his vitals were, quote, very concerning after being diagnosed with COVID-19, and the next 2 days could be crucial for his recovery. That news from a White House source Saturday, standing in stark contrast with President Trump's personal doctor, who painted a rosy picture of the president's condition. He told reporters that the nation's commander-in-chief is, quote, doing very well. Right now, the president is receiving treatment at Walter Reed Medical Center in Bethesda, Maryland. He went there Friday night, and his doctors say that he has started remdesivir therapy. The doctor said that the president is not currently receiving supplemental oxygen, though it is unclear if at one point he did in fact receive oxygen, the doctor dodging those questions. There's also a bit of confusion over the timeline of the president's diagnosis. We heard from the doctors and the medical team there that he is now approximately 72 hours into the diagnosis, which would mean that he was diagnosed on Wednesday. The American people were not aware of his diagnosis until nearly 1 a.m. on Friday morning. We're going to try and clarify all of that. And for the first time since he was admitted to the hospital, the president took to Twitter today saying, "Going well, I think. Thank you to all. Love." Here's some more of what the president's doctor, Sean Conley, said about the president's condition.
I recommended we bring the president up to Walter Reed as a precautionary measure to provide state-of-the-art monitoring and any care that he may need. At this time, the team and I are extremely happy with the progress the president has made. Thursday, he had a mild cough and some nasal congestion and fatigue, all of which are now resolving and improving.
For more on this, let's bring in CBS News correspondent Chip Reid from outside Walter Reed Medical Center. Chip, we learned yesterday that the president did not go to the emergency room when he got to Walter Reed. Instead, he went straight to the presidential suite. I'm wondering, is the president, what more do we know about how the president is working while he's at Walter Reed Medical Center? And if you can tell us anything more about what it's like there. Again, for our viewers, we're told that he was taken there out of an abundance of caution and that he is in fact doing very well today.
Well, we don't know much about what work he actually is doing, but one of the doctors, I believe it was Dr. Conley, who said, by the way, I'm not across the street where the press conference happened. That was just a small press pool asking those questions. So I couldn't see who was talking sometimes, but I believe Dr. Conley said that he has plenty of work to do from the chief of staff. The question is, how hard is he working on that? I mean, they made clear that when he came here, he was very fatigued. So it is certainly possible that that is his condition now, maybe to a lesser degree. But it was basically a good news press conference in terms of his health. So certainly for people who were hoping for that, they got what they were hoping for. But there were also, as you mentioned, some evasions, it seemed, on the question of whether he has gotten oxygen, supplemental oxygen, at any point during this ordeal. The doctors were very evasive. They said at this point he's not getting it, and at that point he did not get it, and at that point he did not get it. But they refused to say that he never got oxygen. And also on a point you mentioned, and this is something that certainly we in the media are going to be digging into, when was he really diagnosed? They said 72 hours this has been going on, but certainly that is not the information we got, which says that he was diagnosed yesterday morning. So certainly more issues to look into here, but bottom line, it was, according to the doctors, a good news press conference in terms of the president's health.
Yes, I know a lot of people are very concerned about that fundamental question, how is the president doing? But there are also these other questions, particularly about the people around the president who tested positive. We're learning more about that event at the Rose Garden, the announcement last Saturday for Trump's nominee, Judge Amy Coney Barrett, to the Supreme Court. Is the White House concerned about the possibility that this was a super spreader event, Chip?
Well, they certainly are not admitting that, but it's hard to believe that they're not concerned about it with all the list of people you just mentioned. And I tell you, when that event happened, there were people in the media and outside the media, numerous people saying this is a recipe for a super spreader event, to have that many people packed together like this, people who are not wearing masks, people who are not only at that moment, but have not been practicing social distancing, especially White House staffers who don't do much social distancing or mask wearing because it's discouraged by the White House. So it looked like it could really be a super spreader event. And if the White House isn't worried about that now, then something's wrong.
Yeah, I'm wondering if you have heard any more information then about what the White House intends to do regarding the campaign, regarding their own protocols to keep staff members and members of the press like yourself who work there out of the White House safe.
Very, very little. We're hearing very little. All the focus is on the president right now, what to do in the future. It really hasn't been discussed publicly that much, but certainly I think we've already seen White House staffers who never used to wear masks wearing them over the last couple of days, at least sometimes, not all of them, but some of them. So I think you're going to see a change in protocol, but the question is whether it's going to be as much of a change in protocol as is needed at a time like this.
All right, Chip Reid outside of Bethesda's Walter Reed Medical Center. Thank you so much.